Members, thank you for allowing me to provide testimony today on Article 2 of House Bill 1 as filed, particularly the DFPS portion of the budget. I'm Rachel Walters. I'm the Senior Director of Public Affairs at the Texas Alliance of Child and Family Services. We advocate on behalf of our nearly 200 members that provide direct services to children and families across our state, from foster care, community-based care, family preservation, mental health services, and so much more. I want to thank you first for your leadership and what's already included in House Bill 1 as filed, particularly the continued statewide rollout of community-based care. What's already included in the bill would ensure that more than 90% of children in our state are served by community-based care providers, including children from all of your House districts. So thank you for that. The department's updated exceptional items would certainly help to support a better rollout of community-based care. Our state spent the last 15 years transforming this system from foster care redesign to community-based care, and we've learned a lot of things that could benefit our state better and improve the implementation process. There are some things we would like you to consider that could sustain the community-based care model better. We'd ask you to direct DFPS to fund community-based care providers to maintain their caseloads by ensuring that the resources provided match with the actual number of children that they care for. We'd love to direct DFPS and the community-based care providers to work better together to identify other functions that live at the agency that could be performed by community-based care providers and better refine the performance measures that are included in their contracts, as well as the data used to determine their performance. And we'd like to see funding to decrease the amount of duplicate manual entry of data into the impact system and improve the interoperability of the systems between community-based care providers and the state. More broadly, our members at the Alliance support a long-term plan for family preservation services in our state. We want to keep families safely together if we can and keep them out of our foster care system. We know the department has an exceptional item to continue the Family First pilots that exist, and we're hopeful to see some legislative direction to better coordinate the services that we do have in our state. And we'd like to see some additional transparency. You heard from the department yesterday, Commissioner Muth mentioned their request to provide more consistency and reason to believe findings. That we're excited to see that, but we'd also like to see information about the findings that the department and HHSC publicly reported to make sure that they're making accurate findings. And finally, we'd love to see some direction to HHSC and TMHP to improve the Medicaid credentialing process. We feel like there's some bureaucracy in the system, and we'd love to allow more qualified service providers to deliver services for kids and families, specifically those involved in our foster care system. So thanks again for your leadership. Thanks for helping to continue to transform our system for kids and families, and I'm happy